on top of the skin, we use a product called hyaluronic acid. And what that does is it just helps the machine to glide over the skin easier. So I'll move that in to the skin, massage it in a little bit, and then we'll get started. So you might not be able to hear me very well once I turn the machine on. So just turning it on, and then I'll adjust the depth. Once I get started, the forehead is a little bit sensitive, okay? So I'm gonna start between the eyes here. Okay, so you'll feel the vibrating.
Tickling my nose, actually.
Yes, exactly. It does tend to cause you to sneeze. Bless you. Okay. All right.
Sorry.
It's okay. I'll give you a gauze here just in case. All right. So then we just glide over the skin, and we do the same depth on the entire face. And what you're looking for, I don't know if you can zoom in on this or not, is you'll see a little bit of punctate bleeding on the skin, and that shows that you're going down into the dermis of the skin, and that's what will stimulate the collagen. It makes the treatment effective.
Sorry.
You can see how. Oh. Turn your head towards me. We're going to go to the cheek. So the cheeks aren't as sensitive because you do have some fat that's there. The temples are. So let me just glide over this temple here a little bit. Okay. You can tell the difference between the forehead and the cheek there for sure.
Definitely.
Yeah, the forehead and around the mouth are the two most sensitive areas. The forehead because there's not any fat there, and then around the mouth because of all the nerve endings. So you go right around the eye, you don't go onto the lower lid itself. It can help on the crow's feet, fine lines and wrinkles, acne, scarring. All those stubborn little lines that you get around the lips. Good. Okay. Turn to this side.
And when would I have to have this done again?
So we do these, you can do them as early as 3 weeks, but you can space it out and even do, say, like 5 or 6, you know, depending on what works with your schedule. But you can do them as early as 3, and that's really what I've been kind of having my patients do right now, is space them out every 3 weeks. You do a series of 3 to 4, and then I would say take a break. I mean, you don't have to keep getting them done. I just had a patient who finished her first cycle. I told her to take a break for 3 months, and then we could do another set if she wanted to, but you don't have to either. I mean, it's basically stimulating the collagen. And you don't necessarily have to keep getting them done. Now, I know in some places they'll put on a topical to kind of numb the skin up a little bit before you do the treatment. But I mean, on a scale of 1 to 10, what would you say the discomfort is right now?
I think it's a 1. I mean,
Yeah,
like
I think it's more annoying, don't you, with the vibrating?
Well, the sneezing was annoying.
Well, yes, yeah, because it stimulates your, yeah, it stimulates that nerve right there. But yeah, and patients don't complain of a lot of discomfort, so I don't necessarily feel that it's necessary to bring them in and have them numb ahead of time. So, you know, we don't do that. I know places that do that. It doesn't mean that the treatment's going to be any more effective. it really is based on the patient's pain tolerance, because the numbing is only numbing up the surface of the skin, and we're going through the surface of the skin down into the dermis. So you can go right up to the lip line. Aftercare, you'll be a little bit red. You'll look like you have a sunburn. Just keep it nice and moist for the first 24 hours with Aquaphor or Vaseline, whichever you have at home, something that's non-scented, hypoallergenic, so it's not going to irritate the skin because all your pores are going to be open. And then after 24 hours, you can start reapplying makeup and using your own skincare routine. You'll notice maybe on day 3 or 4 that your skin might start peeling a little bit, and that's completely normal because this is a resurfacing to the skin. Okay, last part is over the nose. I only do a little bit over the nose, mainly because it can help with enlarged pores. That's just the hyaluronic acid. It's not gonna get out of your eye there. These are stubborn here in between the eyebrows on the glabella, so I usually go over that pretty well. Okay. Sorry, my cord's caught. I'm just going to take that down over the sides of your nose. Do one quick pass over the top. If I make you sneeze again.
I'm getting there.
All right, and we're done.